Hey everybody, it's Ken McElroy here with the Ken McElroy podcast, and I'm here with Nicole Srednicki. Hi, Nicole.
Hi.
How are you?
Good, thank you.
So many of you guys know that I've been doing a lot of health conscious things throughout my life. I met Nicole through actually Robert Kiyosaki.
Yes.
And Nicole does a lot of Robert and Kim Kiyosaki's work. And through my journey, I've learned a lot from her and Radha Gopalan, her partner in the business Ultra Healthy Human. And what we're going to talk about today are a bunch of things. Now, the reason why I wanted Nicole on the podcast was because Nicole's your typical A student that worked really hard, got into the medical field, was in the middle of the grind, making lots of good money, but didn't really have a real quality life. She was working a lot. And, you know, it takes a lot of work, obviously, to get through through the different medical schools and through the different certifications. And she was working a lot. And so her quality of life outside of work wasn't that great, even though she was making a lot of money. And so when we met, she ended up leveraging her experience coming out of that, started her own business, and now has bought some real estate. And we're going to talk a little bit about that, but that's part of the journey and part of the path we want to discuss. But Nicole, before we get into that, what are 5 things that, you know, people can do to get more healthy? You know, I know, you know, I've done a lot with you. So what are some of the things that people can do, really simple things that they can do right now today to make them feel better?
So first of all, thank you, Ken, for having me on the show. I want to start by saying, top 5 things. Something that a lot of people don't really think about is age management. So we start aging very, very young, but we don't start manifesting symptoms until later in life. And so, you know, there's basic things like the way we eat and exercising and things like that. But when we think about true age management, we want things to really halt the aging process. And one of the newest things that I've brought into my practice is called exosomes. And exosomes are the latest science in stem cell technology. So there's been a lot of hype about stem cells, but exosomes are actually the mechanism of action for these stem cells, and these actually help regenerate your own cells and tissues to keep you young and help to regenerate tissues like if you're having knee arthritis or an autoimmune issue like asthma, things like that. I think these are huge things that people, until they get really sick, kind of neglect. And I think it's something that people need to be mindful of at a very, very young age. And then just some other things that people can be doing is, looking at heavy metal status. So it's something that, Ken, you and I have talked about a lot. And our environment, unfortunately, is horrible no matter how healthy we try to be. So I encourage people to kind of look outside the box and do things like get your heavy metals checked.
So what she's talking about there is I did some blood work. Actually, I've done a bunch of blood work. And a lot of doctors don't take the extra time to look at. Now, I'm not sure exactly, but I know when I go to my other doctor, they would go, "Okay, you're looking good," but then you actually took it a whole different level. You had a different level of blood work, and in that blood work, we found that I had personally high mercury, high lead, and something else.
Sure, aluminum.
Aluminum. So I had those in my system for whatever reason, but my primary doctor didn't see that. So then we went through this process called chelation, right?
Yep.
So you can explain, because I think a lot of people go to their primary doctors, and when I started going to you, you're like, yeah, well, this is like the basic thing that we do for blood work or hormone work or whatever, but then there's a whole nother level, right? Can you walk me through that?
Sure. And that's another aspect of preventative medicine or age management. And that's really looking at these fine details. And also part of why I started my own practice. I wasn't really happy with just conventional medicine for my patients because all it did was screen for, very basic disease that might already be there, or, when something's already going wrong and you're having symptoms. But what I do is I try to almost forecast, what's down the road. load. And so, I look at very extensive blood work. Heavy metals is one example. I look at inflammatory markers, and this looks at, your cellular layers and your tissues to see, is there something abnormal starting very early on that we can stop now so that we don't have to deal with the ramifications later, just like heavy metals. Heavy metals are known as neurotoxins. They'll increase your risks of cancer, premature aging, Alzheimer's disease, horrible diseases that no one ever should have to live with. And so that's why we did this screening very early on, even though you weren't having symptoms. Right. And so when we saw that you did have very high levels, we started working to get this out of your tissues so that they didn't accumulate, which they do over time.
What I thought was cool was I was fine on like 100 things.
Correct.
Right, but there were 3 or 4 things that I was high on. And what I found most interesting was that we're actually getting preventative. You said these high levels will turn into potentially Alzheimer's and cancer and things like that. And what I really found interesting is my primary doctor had the same blood, obviously, from me, and they're within the tolerance level. So they had a tolerance level that was okay to have all this, right?
Right.
And I went to you and you're like, okay, well, our tolerance level is 0. We don't want you to have any heavy metals. Whereas you go to a primary doctor, they say, okay, it's okay for you to have a certain amount. So I remember that being, well, why would one doctor, say it's okay to have some heavy metals and you say none, and I think that's the difference of, being healthy long term.
Sure. And that's also why, I sometimes reference conventional medicine as sick care, because that's the way conventional medicine, they train us to, when you're sick, when you're so far down the pathway, then we just start treating symptoms instead of stopping this, which is why I say, no, you should not have any mercury in your blood, not the acceptable amount that, they're telling you is acceptable, because they're putting you in this statistical category with everybody else in the country. And you see it. Look at how packed our hospitals are with sick people and people with all of these symptoms and more cancer and autoimmune issues. And it's because we aren't doing preventative medicine or age management.
Right. It's so important. So the first one was a stem cell. Second one was heavy metals. And what's the third one?
Yes. So stress management.
Yeah.
So that was actually, I finished my doctorate at Georgetown University about a year and a half ago. And my study of interest was stress management. And I wanted to figure out a way that we can decrease stress levels and improve mindfulness to then enhance our work outcomes and our own, the way we function in life and our level of the way we know that stress can affect everything in our life. It can affect our blood pressure. It can affect our relationships. It can affect our business outcomes. And so, doing things, being mindful of this, first of all, we oftentimes build up a tolerance and say, oh, I'm not stressed. And when you actually measure it, like, when I do a scale with a patient to actually see how stressed they are, they're like, oh my gosh, this is one more thing that's going to cause premature aging. And it can actually hinder your own thought processes. So as an entrepreneur, being mindful and keeping my stress in check is so important.
I know. Here's the thing, though. Like, it's hard to recognize.
Yeah.
It's really hard to recognize when Dr. Rada's book came out, the 8 deadly...
Second Opinion, 8 Deadly Diseases.
The Second Opinion, 8 Deadly Diseases. I highly recommend that book. It's all of those things start from stress.
Yep, absolutely.
Basically what he's saying is every single disease that you get it manifests actually from stress.
Oftentimes, yes. And so the stress can actually, it affects first our thought process, which can then trigger an emotion. And then over time, all of these very subtle changes that we might not recognize, they actually start to manipulate our cells, our tissues in our body. And then this is when disease can actually start.
It's bizarre to me, but it's true, right? And so one of the things that I think what happens, especially with entrepreneurs, is, they're going 100 miles an hour and they're trying to balance their health.
Yeah.
They're trying to, they're on a plane, they're flying around, they're in high pressure meetings. They have a lot of times a lot of employee issues, a lot of financial issues, and a lot of things going on.
Yeah.
Every phone call sometimes can be stressful. And then they go home, and if they're not in balance there, it's even more. And so how do you recognize stress? Because I know for me, I just compartmentalized it and moved it over here and just kept plowing away. And I think that's what happens a lot of times is people, they're working really, really hard and they're not recognizing it.
Absolutely. Yeah. So, I think going back to prevention again, making sure that you're having time for you. For me, what I do to help manage my stress is I meditate every morning. I make sure that I'm going to the gym. Those are some of the best ways that I manage my stress. I leave time aside for things. Sometimes I just have to take a step back, and it's very hard to recognize. But I think also having a health advocate that can help point that out. I often bring this up to my patients when they come in and they're telling me all of a sudden, well, I'm having issues, with my sleep, or I'm feeling more tired, or I'm having headaches. We always go back and assess their stress level.
Right. Yeah. I find even, I was thinking of this, I have a friend of mine and he literally can't sleep at night. Mm-hmm. And it's because his mind is going 100 miles an hour all the time. And I'm like, hey, you really need to calm down that mind of yours, right? Because once you can calm down and be present and start and be mindful of what you're thinking, then I think that, you'll start to get a much, much better sleep. And he started doing meditation and some other things, and it started to work.
Yeah, absolutely. And then as an entrepreneur, it helps you make better decisions
I for sure. I found that if I don't go to the gym, and of course I meditate, not as religiously as you do, but I do. But I find that I come in to the office a lot more grounded, a lot more present, and I'm making better decisions because I'm not thinking about everything all at once.
Sure. And actually going back to my thesis when I was working on my doctorate, and one component of I trained the participants in meditation, and we had a different type of intervention that we used to try to help people become more mindful of their stress management. But something interesting was what people reported was people around them at work, they were noticing. They had no clue that they were all of a sudden meditating to try to reduce their stress levels. But as we went through this study, people around them were actually noticing they were different. They were easier to get along with. Their decision-making capabilities were better.
Nice.
Yeah.
Nice.
So
that's interesting.
Yeah.
Okay. So meditation is 3. What's 4?
Detoxification. So this is something that it's a very generalized term. You hear about detoxification, you hear about cleanses, juice cleanses, all different things. And there's different levels. And, one of the things that I work on with my clients is to make sure that we pick a detox that's appropriate for them and that's sustainable so that they can not only reach the goal, but feel empowered and hopefully sustain some of the benefits. Now, I have some patients that come to me for the very first time and they say, oh, no, I eat healthy. I feel great. I don't need to do this. But sometimes we need to be mindful of our environment and the air we're breathing. And no matter how healthy we try to eat, sometimes the foods that we're eating, just like you eat healthy, but we found all of these heavy metals.
Right. Yeah.
And so, it's all part of age management and kind of taking a step back sometimes, clearing out those toxins. And I put basically all of my patients through some type of detoxification program. And it's so fun to watch this because at the end, they have all benefited in some way. If it's decreased joint pain, they have more energy, they're sleeping better, their skin looks better. So many different things, just kind of going back to the basics.
Yeah. One of the things that I do, as you know, is I do these cleanses, for me, they're 21, I do 2 21-day cleanses a year. And I tell you, at the end of that, the goal is not necessarily to lose weight, but at the end of that, my digestion's better, my